Understanding the success rate of dental implants. Dental implants are now an extremely popular method of filling and missing teeth due to their long-lasting durability and their natural appearance. Before going through the procedure, many have questions about the effectiveness that dental implants can achieve. In this clip, we'll look at the various factors that affect the efficacy of dental implants as well as review the success rates of this treatment. Factors affecting the success of dental implants. 1. General health of the patient. One of the most significant aspects that affect the performance implant surgery is the health of the patient overall. Medical conditions like diabetics, autoimmune diseases, and cancer may affect the body's capacity to heal well following surgical procedure. This is why it's essential for patients to talk over their medical past with their dentist prior to going through the procedure. 2. Jawbone density. Success of dental implants depends on the size of the patient's jawbone. A healthy, strong jawbone can provide support to the implant and guarantee its durability. When the jawbone strength is inadequate or thin, the possibility of a bone graft could be necessary prior to implant surgery in order to enhance the odds of a successful surgery. 3. The proper oral hygiene is vital to the long-term success for dental implants. Patients need to maintain proper routines for oral hygiene, which includes cleaning and flossing frequently to stay clear of diseases that may cause problems for the stability of the implant. Regular checkups of the dental health are vital to assess the condition of the implant and its surrounding tissues. 4. Smoking cigarettes. Smoking cigarettes can be an extremely risk factor for tooth implant failure. Nicotine and the other substances in cigarettes can delay the process of healing as well as increase the likelihood of developing infections and lower the rate of success of dental implant surgery. Patients who smoke should be advised to cease smoking before having implant surgery in order to boost the chance of a successful outcome. Average success rate of dental implants. There are many variables that affect the performance of dental implants. Research studies have found that the overall performance of this treatment is about 95%. This success rate could be due to advancements in dental technology, better methods of surgery, and the better implant materials. It is vital to keep in mind that the effectiveness of dental implants will vary based on the specific circumstances of each patient. The location of implants, experience of the dentist, as well as the level of commitment by the patient to the practice of oral hygiene will all impact the results of the surgery. Dental implants generally offer a high percentage of success, and they are believed to be as a secure and efficient treatment choice for the replacement of missing teeth. Implants can be expected to last for a number of years, provided they take care of them and routine maintenance. Conclusion. In the end, the successful rate for dental implants is extremely excellent, with studies revealing an average of about 95%. Things like the condition of the patients, the density of their jawbone, oral hygiene, and smoking may affect the effectiveness of the procedure. If they take care to consider these elements as well as following the suggestions of their dentists, the patients will increase their odds of a successful success by using dental implants. If you're thinking about implant dentistry as a possible treatment solution for missing teeth, it is crucial to talk with a licensed dentist for a discussion of your personal demands and to determine if would be a good candidate for this procedure. When properly cared for and maintained, implant dentistry can offer the long-term solution needed to restore your confidence and appearance.